Welcome everyone to our Bold Public Health Center of Excellence on Dementia Caregiving webinar. We have around a minute before we begin. I just want to welcome you and let everyone know we'll be starting shortly. Thank you. All right, well, welcome everyone. I think we'll be starting right now. Thank you on behalf of the Bold Public Health Center of Excellence on Dementia Caregiving. My name is Joe Gogler. I direct the center, and we are just thrilled to have you here with us today for what we hope is going to be a very exciting, very interactive discussion panel on what I believe is a landmark development in family caregiving. As I'm sure many of you know, in September of 2022, the National Strategy to Support Family Caregivers was delivered to Congress. This report was developed by the Recognized, Assist, Include, Support, and Engage, or RAISE Act Family Caregiving Advisory Council, as well as the Advisory Council to support grandparents raising grandchildren. And why I think many of us in this space of family caregiving think this report is so important and such a milestone is that it offers a set of recommendations to really advance how different levels, both nationally, state level, community level, healthcare organization level, a number of recommendations that can be employed to best support family caregivers who are caring for individuals with various types of health needs. And the purpose of our webinar today is to really link this critical work, this critical report, which is really the result of decades of efforts on the part of policymakers, advocates, family caregivers themselves, researchers in this space, to really lay out a map, a plan to best support family caregivers and to essentially provide a policy architecture to achieve what we all are striving towards, which is to best support family caregivers who are assisting individuals with health needs. And today, we really wanted to bring in some of the architects of this report, as well as highlight some states to link these recommendations, these hundreds of recommendations in certain ways, shapes, and forms to the dementia caregiving space, and specifically to the dementia care space and public health. So we're very excited to have you here today. This is again a real milestone, and we certainly at the Bold Public Health Center of Excellence on Dementia Caregiving are excited to further highlight this work and really lay out ways to think about how we can take this report and make the recommendations actionable. Next slide, please. You've already heard from me as the director of the center. We welcome you. We're very excited again to be highlighting this crucial report and strategy for you here today. Next slide, please. We always feel it's essential to begin with a land acknowledgement. The University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values: courage, wisdom, respect, and generosity. So real briefly, to give you a very, very quick overview of our center is really designed to disseminate to public health agencies at the local, state, tribal level, but then more broadly to all of those who care for individuals living with dementia, and really to work in concert, to serve as a convener, to also serve as a source of technical assistance, to identify ways, number one, we can best support individuals who are providing unpaid care to those living with dementia, and then also to advance evidence-based or evidence-informed innovations to best accomplish those goals. In a nutshell, that's what our center is. Our center consists of a very vibrant health equity task force that centralizes and elevates issues of health equity, as well as a national network of many organizations that have all been involved in either the policy space, the service development space, or the scientific space to, again, best support and understand dementia caregiving. Next slide, please. We are thrilled to have this very esteemed panel that we feel are going to be able to talk about the National Family Caregiver Support Strategy, recommendations, and report from a number of different vantage points and perspectives. And I think when you come out of this panel, you'll really have a better sense of how we can take the we can take the recommendations and employ them to best support dementia caregivers. So we'll have Wendy Fox-Grage. She is a project director on behavioral health and the aging and disability team from the National Academy for State Health Policy, and played a leading role in actually delivering this critical report. We're also excited to have Dr. John Amura with us, who's a medical officer of the Alzheimer's disease team of the CDC, someone that our center works closely with, providing and giving us a better insights into the public health perspectives of both this report and dementia caregiving. And then we're very excited to have three individuals that will talk about their own work, how it aligns with the the National Family Caregiving Strategy in their own states and localities. This including is Liz Head, from the Georgia Department of Public Health, Dr. Kina White. She's the director of the Office of Community Health Improvement of the Mississippi State Department of Health, someone who's been featured in some of our past webinars. Very excited to have her. And then Erin Fay, a program manager from the Alzheimer's disease program at the New York State Department of Health. Again, very exciting panel that we have convened here for you today. And we're really looking forward to hearing from you. If you have questions for the panel, please do utilize the Q&A function in Zoom to ask those questions, and I'll be collating them throughout the discussion and conversation today. And at the end of our panel time, I'll get back to that. And again, we're trying to make this as an interactive experience for you as possible. So next slide, please, Alma. So I'm going to turn it over to you, Alma, and specifically Wendy Fox-Grage, and Wendy will take us from here. Thank you.
Great. Thank you so much, Joe, and your entire team for having me here today on this webinar. What an honor. Next slide, please. Okay, well, there I am. I'm a senior policy fellow at the National Academy for State Health Policy. Next slide. And NASHP is a nonprofit organization, and we're all about and by and of and for state health policymakers. And I work in Washington, D.C., and we're a nonprofit organization. Next. And I've got a really cool job. As Joe was saying, I direct the RAISE Act Family Caregiver Resource and Dissemination Center. And you can see in the header there, the URL to our website. This is a screenshot of our website. Our website was actually just redone, just very recently. It looks a little different, but it has all the same great information. Everything I talk about today is on this website. We've got everything you probably ever wanted and more about the Family Caregiving Advisory Council, a faculty of experts that provide guidance, all kinds of materials, resources, and state resources such as respite care and more. Next. Before I go any farther, I want to also acknowledge that our RAISE Center, we are really fortunate in that we work very closely, we're funded, and we also are partners with the John A. Hartford Foundation. And we're also connected at the hip with the U.S. Administration for Community Living to carry out the RAISE Act and to support the RAISE Advisory Council. I was asked to talk today specifically about the brand new national strategy to support family caregivers. And boy, are we excited about this. As Joe said, it was released in September to the U.S. Congress and to the public. And in fact, up there in the header, you can see the URL. We encourage everyone to read the strategy and to speak out and let others know about it. It's at acl.gov/family caregiver strategy. The strategy actually is huge. You can see the amount of effort that went into this. It's actually in 4 papers, but the crux of it is in the actions. It puts forth about 350 actions by 15 federal agencies, and it also includes 150 actions by state and local governments, community-based organizations, the business sector, and others. So it's not, even though it was issued to the US Congress, it's not only just a federal initiative, it's very inclusive. And that's why I'm so thrilled to be speaking on this webinar today, because we need all of you to help make the strategy, to implement it and make it a reality. And family caregiving, it's very much a public health issue. And so all of those actions, those 500 actions, they're organized along a framework of 5 goals. And I'm going to go over those in about 2 seconds flat, in the interest of time. Goal 1 deals with increasing awareness and outreach to family caregivers, because we know that they often do not self-identify and they don't know where to go for the information that they need. Goal 2, advancing partnership and engagement, really listening to the family caregiver. Our priority is the person needing the care. So we often kind of forget about the family caregiver, and that's really listening to them and assessing them for their own needs. Goal 3, of course, strengthening services and supports. For example, respite care. We had listening sessions with family caregivers all across the country. And what we often heard is that they need a break. So that's respite care that can give them that break. And then we heard how difficult it is with the workforce shortage, in particular, the direct care workforce shortage, and being able to get an aid that can provide help to family caregivers, particularly in the home, in community-based settings. Goal 4, some of the most compelling and actually heartbreaking information that we heard from family caregivers was around some of the financial strains in family caregiving. And we also heard from a number of family caregivers who were juggling work, their paid employment, in addition to their caregiving responsibilities. So a lot of actions in that area dealing with leave and anti-discrimination in places of employment and so forth. And then finally, goal 5, dealing with data, research, and evidence-based practices, of which, the public health community is just so important. And I just want to let you know that when you read the national strategy, you'll see a number of different action steps that include in the national strategy this very own BOLD Public Health Center initiative by the CDC, as well as, again, by the CDC, an update of the Healthy Brain Initiative Roadmap. And I know John, who's going to be speaking right after me from the CDC, will be telling you a little bit more about that as well. Next slide. Okay, this is a resource that my organization put together that I thought would be just a particular interest in this call, because this is what we call our our RAISE Act State Policy Roadmap. And in this, it's a 6-paper series, and you can see all the papers there. And these highlight specifically state strategies, as well as promising practices for implementing the national strategy. And here is the URL that we have here on the slide. Next slide. So now what I'm going to do is, I don't have, in the interest of time, I can't go through all of the different papers and what all the state actions are and promising practices. So I'm just going to give you a little taste of some of it. This one I think is a particular interest. This focuses on state actions for services and supports for family caregivers. And we know that states often hold the purse strings to the public funding for these programs. And so this we focused in on, and we were working on this kind of in the height of the pandemic. And we knew that funding was a huge issue. So this particular publication and these strategies deal with kind of blending and braiding all the different funding sources and leveraging, for example, the newer pandemic related funding that states have received, rebalancing, because we know many families want to be able to care for their loved ones in the home and in the community, and then even using public funds, like through Medicaid, through self-direction programs to actually pay family caregivers. Next slide. Here are just a couple of promising practices. Connecticut, I was really fortunate. In this past year, we were able to work very, very closely with 6 states as part of a state policy academy that we held in providing TAs. Connecticut was one of those. I was able to work with them on this. They are using that pandemic-related funding called ARPA funding. It's the American Rescue Plan funding, using that to incorporate family caregiver assessment training and other services for caregivers of those with Alzheimer's and other dementias. The nice thing is pandemic related funding, much of it was very short term, but in Connecticut, they're using this funding and it will become permanent within their programs. In Montana, again, another example of this is they were able to use their Alzheimer's disease program grant monies and use that for training dementia care navigators who work in their aging disability resource centers and area agencies on aging to help, in particular, the caregivers of people who are caring for those with dementia and related type conditions. Next slide. Okay, this is another example of, state actions to use, research data and evidence-based practices. Here's just a couple of strategies listed here. I just want to point out, so when we use the term family caregiver, we're using it in the national strategy, it's a broader definition beyond blood relatives. It could be, friends, neighbors, etc. The other actions include the collection of family caregiver data and outcomes, compiling, state inventories of the state family caregiver services and where they are within the state evaluation, so we know what's working, what isn't, what needs to be changed, and then implementing evidence-supported programs for family caregivers. Here's on the next slide, you'll see a couple of examples of promising practices. New York, you're going to hear from Aaron from New York in the state panel discussion. So I won't go into too much detail on this one, but I just wanted to let you know why we included this as a promising practice. So states can use, and you're going to hear about this from John, states can use something called the BRIFIS caregiver module. It's from the CDC. It's optional for states, but they can use that to collect really critical information on family caregivers. And what New York has done is they're using that data for an evaluation, as an evaluation component of their Alzheimer's disease caregiver support program. So we thought that was absolutely promising. Massachusetts is using some funding for evidence-based programs across several of their programs. And you can see all the different programs and they're funded in all different ways. But just as an example of some of those, the Savvy Caregiver program, and they have it in both English and Spanish. It's a 6-week program for caregivers, dementia and training techniques to really manage stress. The Powerful Tools for Caregivers, that's also a 6-week program for caregivers dealing with self-care and stress management. And again, being able to use those evidence-based programs are among a variety of their public programs. Next. Okay, this I'm going to end with because this is probably the biggest question that I get is, now that we've got the national strategy, what's up? What's next? Okay, so here's what we've got cooking. And before I even go into that, the biggest thing is that please, if you can, read and speak up, let others know about this national strategy. It really is a shared vision. And so you can help us by getting the word out. Again, the strategy is located at acl.gov. That stands for the Administration for Community Living / caregiver strategy. So the previous RAISE Advisory Council, they each had 3-year terms. Those terms have expired. And so there's going to now be a new RAISE Advisory Council with new members. Those are right now in the process of being appointed, and those will be announced soon in the spring. And then that RAISE Council will focus on updating and implementing the RAISE strategy. When the national strategy was released, there was a call for public comments. Right now, the UMass Boston, the researchers there are analyzing those public comments. And the plan is that once the new council is appointed and they have their big full council meeting in the spring, the researchers will present the findings from those public comments, and then the new RAISE Council can take that upon advisement and use that for the update and implementation. So that will inform their work going forward. All of the full council meetings, I encourage you all to watch those. They're all live streamed and they're open to the public. I don't have the exact date yet for that council meeting. If I did, I would have given it to you, but I have a website where you can just check. It's a great website to look at anyway, but that's where you can check. And that's where there will be a live link once we do have a meeting and you can see their proceedings. That's at acl.gov/RAISE. And then the plan going forward is to update the national strategy to support family caregivers every 2 years. So this is our first step, and it'll be an iterative process every couple of years where we update the national strategy. And with that, I'm going to turn it back over to our moderator, and John is up next from the CDC. Once again, thank you so much for having me.
Great. Thank you so much, Wendy, and good afternoon, everyone. It's really a pleasure to be here today, and thank you to Joe and the Bold Public Health Center of Excellence on Dementia Caregiving for the invitation to participate in this great webinar. So my name is John Omura. I'm a medical officer on the Alzheimer's disease team at the CDC, and I'll be giving a brief overview today of a public health approach to dementia caregiving. Next slide, please. So just very briefly, I'll give you all a quick overview of caregiving, and then really taking a step back to explain what we mean by a public health approach. And then I'll provide a brief overview of some of our initiatives at CDC, as well as other ongoing policy and national initiatives as well, and really giving a sense of how all of those initiatives align. And I wanted to mention as well that throughout my presentation, I have some of our CDC resources included, but there are many others as well. So certainly, please do feel free to reach out to me anytime. My contact information is provided on my last slide. Next slide. Great, thank you. So certainly, I know everyone here is familiar with the issue of caregiving. And just to give a brief overview of some of the data that really elevates the importance of this as a public health issue. In 2020, an estimated 21% of adults identified as being a caregiver. Certainly, we all know that caregiving can have significant benefits, including enhancing the bond between a caregiver and their care recipient, but it can also, of course, place significant strain on the caregiver, including impacting their emotional health and physical health. And as the number of older adults in the US is projected to increase, so will the need for caregivers. Next slide. And so as I mentioned, of course, caregiving can impact the caregiver's own health. And this is just an example of some of the data that we collect at CDC and how we use it to examine some of those issues. And so, for example, this paper in the Morbidity and Mortality Weekly Report looked at subjective cognitive decline among caregivers, and it found that 1 in 8 adult caregivers reported having subjective cognitive decline, which is the self-reported experience of worsening confusion or memory loss, which is an early indicator of potential dementia. And also that cognitive decline was higher among caregivers than non-caregivers. And that caregivers with cognitive decline were more likely than those without cognitive decline to report chronic health conditions, depression, as well as other limitations. So certainly this is an important public health issue for us to address. Next slide. So given the importance of this as a public health issue, really, what do we mean by taking a national public health approach? Next slide. So really, when we talk about a public health approach, we're really talking about moving beyond impacting individuals one at a time, those one-on-one encounters, those clinical encounters, and rather moving to impacting many people at a time, really trying to impact people at a population level. And we do this through various interventions that are oriented towards policies, systems, really thinking about health systems and other types of systems where we can impact change, as well as impacting the environment in which we live and operate. So those policy systems and environmental interventions can really impact many people at a time. Next slide. And then as part of that, CDC really, and for public health in general, we really see ourselves as a key facilitator of bridging a critical gap. We know that there is essential and cutting edge research happening all the time in our field, and that is really critical to advancing strides in our field. And then similarly, we know that there is critical work happening at the community level as community services are being implemented by those key community-based organizations. And we really see ourselves as helping bridge a gap between those two efforts by looking at the research that is emerging, understanding it, and then translating it, packaging it, and disseminating it in a way that is useful and readily actionable for those community programs and services. Next slide. And so when we talk about really implementing a public health approach, there's a variety of action initiatives that we do, but part of that is, of course, data for action. We collect data and then repackage it so that it is readily available for public health action. And as Wendy mentioned, one of the ways that we do that is through the Behavioral Risk Factor Surveillance System, or BRFSS. It is, in case you're not familiar with BRFSS, it's one of CDC's premier national surveillance systems. It collects data at the state level, and it looks at a variety of different chronic health conditions as well as health behaviors. Next slide, please. And so within BRFSS, states can opt to administer a variety of optional modules, and our program sponsors 2 optional modules. One is on cognitive decline, and I already presented some of those data earlier. And then the other is around caregiving through the caregiver module. And so on the map here, you can see the states that opted to implement the caregiver module over the past couple of years. So you can see we have great representation across the country, which just provides truly rich data around caregiving. The caregiver module asks around whether people identify as a caregiver. And then if yes, it asks a variety of subsequent questions around the duration and intensity of the care that they provided, the type of care, and what is the main medical issue that they're providing care for. Next slide. And so as I mentioned, we really try to take those data and make them actionable for people. So I just wanted to provide a few examples of resources for you here. Here are some infographics that we create. We provide national infographics around caregiving, which is on the left. We also provide it at the state level. So in the middle there, you see Georgia as an example. We provide some of the infographics in Spanish, and then there are also a variety of other subpopulations available on our website, including by race and ethnicity, sex, LGBT status, etc. So lots of great resources in terms of data for you. Next slide. And then there are really 2 main public health initiatives at CDC that we lead, and I'll touch on both of them briefly for you here. One is around the Healthy Brain Initiative. Wendy mentioned this in her presentation as well. One of the core elements or components of the Healthy Brain Initiative is developing and implementing the roadmap series. I'm sure many of you are familiar with the roadmap. This is a roadmap, and the different iterations are on the bottom of the screen there. But the roadmap is really oriented towards state and local public health organizations and professionals for them, and it provides them public health strategies to promote brain health, address dementia, and I just wanted to point out specifically also to help support dementia caregivers. So caregiving is integrated throughout the roadmap. And within the roadmap, there are 25 actions, and those 25 actions are organized around 4 essential services of public health. And you can see those on the wheel on the top right of this slide. It's a bit small, I'm sorry, but those 4 essential services of public health that those actions are organized around are to assure a competent workforce, to monitor and evaluate, to develop policies and mobilize partnerships, and then to educate and empower communities. Next slide. And so I wanted to just give you a few examples of those actions that are in the roadmap that are specific, that touch on caregiving. So just to give you a sense of how caregiving is integrated into this roadmap. So for example, under that essential service of educating and empowering, there is an action E3 you see there, which is to increasing messaging that emphasizes the important role of caregivers and the importance of maintaining their health. There's also an action around improving access to evidence-based or evidence-informed interventions to support people with dementia as well as their caregivers. In terms of developing policies and partnerships, there is an action around engaging public and private partners to develop services and policies that promote supportive communities and workplaces, both for people with dementia and their caregivers. Next slide. In terms of the essential service or the category of assuring a competent workforce, there is an action to educate healthcare professionals around the health risks for caregivers and to make sure that they have access to supportive programs and services. And then lastly, around monitoring and evaluating, there is an action to support national data collection on dementia and caregiving, and then subsequently to use those data to inform public health programs and policies around caregiving. So I just wanted to give you those examples of how caregiving is integrated into the roadmap throughout, and just remember this as I come to a subsequent slide around the national strategy. So next slide, please. So that was the Healthy Brain Initiative. And then I also just wanted to briefly touch on BOLD as well. Of course, you all are familiar with BOLD since we are on a BOLD Public Health Center of Excellence webinar, but BOLD stands for Building Our Largest Dementia Infrastructure. It's really designed to create a strong public health infrastructure for dementia and dementia caregiving. So through BOLD, there are 3 pillars. One is to establish centers of excellence. One, of course, is the Center of Excellence on Dementia Caregiving. Another pillar is to provide funding for public health departments across the country to really implement actions around dementia and caregiving. And then the third pillar is around increasing data analysis and timely reporting. Next slide. And so as I mentioned, and we're all familiar with the Public Health Center of Excellence on Dementia Caregiving, I just wanted to spotlight them again. I know Wendy mentioned it as well, but they have just made such amazing strides for our field, and we are so grateful in really elevating dementia caregiving as a public health issue overall through their dissemination work, their technical assistance, through their partnerships and convenings, just a huge resource for our fields. So many thanks to them. Next slide. And then I'll just briefly walk you through some other policy and other ongoing national initiatives as well. So next slide. This slide gives a brief overview of some of the timeline of the major milestones in terms of national policy initiatives dating back to 2005. So you can see in 2005, the Healthy Brain Initiative was established with congressional support. Subsequent to that, there was the National Alzheimer's Project Act and the first national plan to address Alzheimer's disease, the Raise Family Caregivers Act, and then moving forward, of course, was BOLD. The BOLD legislation was passed. And then excitingly, as we're talking about today, the RAISE report to Congress, and then ultimately the recent RAISE National Family Caregiver Strategy that was just released. Next slide. Yeah, and so then just in the my final slides, I'll give you a sense of some of the national initiatives. So one is, as I mentioned, the National Plan to Address Alzheimer's Disease. This is really a guiding document for the country in terms of addressing Alzheimer's disease, and caregiving is integrated, dementia caregiving is integrated throughout the national plan. And I just wanted to highlight, for example, the third goal. There are 6 goals of the national plan. There were previously 5, now there are 6. But I wanted to mention the third goal, which is to expand supports for people with Alzheimer's and related dementias and their families. So just to mention or highlight the integral role of caregiving specifically within that goal. Next slide. Yeah, and then as Wendy provided a great overview of the national strategy to support family caregivers, which was just released last year, we're so thrilled and excited about this. It is such a milestone for the field of family caregiving and also dementia caregiving as part of that. And it's just a real milestone and helpful for us to elevate this critical public health issue to the national level and really provide a guiding document for us to help move forward. And as Wendy mentioned, the strategy is oriented around these 5 main goals, which are to increase awareness and outreach, build partnerships and engagement with family caregivers, strengthen services and supports, ensure financial and workplace security, and then finally to expand data, research, and evidence-based practices. Next slide. And the reason I wanted to just highlight both the roadmap and then those 5 goals of the national strategies to support family caregivers is I hope you can see some of the similarities or synergies that exist between these 2 documents. There is a lot of overlap, even the way that they are organized and structured, there's a lot of parallels between them. And to me, all that goes to say that, you know, these initiatives are really not working in isolation. They are not disconnected, but rather they are working in concert with each other, striving towards really what is ultimately a shared goal or vision for caregiving for our country. And so as public health practitioners, if you are implementing actions to support dementia caregivers from the roadmap, for example, you are already contributing to advancing the national strategy to support family caregivers. So lots of synergy, lots of parallels, and again, all working towards advancing really what is ultimately a shared goal. Next slide. So I will stop there. Please stay connected with us through our newsletter. We are continually disseminating great resources that we develop, as well as our great partners, including the Bold Center. And next slide. With that, I will close and say thank you for your attention. And I'm happy to, like I said, please reach out if you are interested in obtaining any other resources as well. And I'll pass it back to our moderator. Thank you.
Thank you so much, Wendy and John, for this great introduction to the RAISE strategy and an overview and really of how it fits, how this new strategy doesn't exist on its own. It really fits together with other national initiatives, federal initiatives to support people living with dementia and their families and caregivers. And really in reviewing the state dementia plans, we can really quickly see that public health is already doing a lot of work across the US that is already aligned with this strategy. So there's a lot of opportunity to build and expand on this work and continue to fill gaps and elevate it. By the way, my name is Elma, and I am the coordinator of the Public Health Center of Excellence on Dementia Caregiving. Sorry, my apologies for missing that introduction first. So here we would like to turn to the next section of today's webinar, and it will be a panel conversation where we will continue to hear from more states, today from Mississippi, Georgia, and New York, about what they are doing that is aligned with this national strategy and specifically related to supporting caregivers of people living with dementia. And again, as Joe said it earlier, we're trying to build a community of practice. So as you hear our panelists speak today and share their work from their states, please use the chat feature in Zoom to share your work. What are some of the takeaways that you are going to bring home to your agency? And what are some ideas that you may want to share, some successes from your work or lessons learned? And please use the Q&A feature to send us your questions, submit your questions as you hear our panelists speak. And we will have time at the end of the webinar to answer those. So now I invite Liz, Erin, and Kina to please turn their cameras on. Welcome again. We are thrilled to have you. Thank you so much for joining us today. So let's begin just first with the first question. Looking at the RAISE strategy recommendations, what actions or initiatives related to dementia caregiving are you already doing in your state that are aligned with the strategy? And again, as you answer, here are those goals of the national strategy that you can refer to as you speak. And maybe we can begin with Kina.
Sure. So I bring you greetings from Mississippi and our great Alzheimer's team. Thank you again for the opportunity to speak to everyone. We have a few activities that we are implementing in parallel to the strategy. And so one that I will share is collaborating with our state Alzheimer's Association chapter. Once we received our BOLD funding, we began conducting Caregiver University conferences. They're virtual and in person, and they're a great opportunity to not only work with professionals, but hear directly from the caregivers themselves about some of the resources they may need in our state. And something that was brought up in our BOLD Center of Excellence meeting in Minnesota, but also was brought up in our local meeting in Mississippi, is that for those that have early detection, they still want to work, and caregivers may not be available to stay home. And so those individuals need additional resources that may be available for the younger aged individuals that are diagnosed, not just the older adult individuals. So with our caregiver conferences, we provide that opportunity. Another way, and I know that Liz will talk about the BRFSS piece, but we also implement the caregiver module, and we were able to get our state BRFSS coordinator to do a 3-year trend analysis of our subjective cognitive decline data and an analysis of our caregiver module data. And we took that information and translated it into some of our own BOLD implementation strategies. So those are just a few examples. I'll let my other colleagues give some of theirs, and then I'll come back if we have more time to just share a few others. So Erin or Liz?
Sure. Greetings, everyone from Georgia, home of 2-time national champions. I'm supposed to say that, so go Dogs. Really excited to be here with my colleagues today and appreciative of the opportunity. As Kina mentioned, we do BRFSS for both the caregiver module and the cognitive impairment module here in Georgia. The way that we have worked on this to be able to afford the modules and have regular data coming in is we do the caregiver module in even years, and we do the cognitive impairment modules in odd years. And we've been doing that since 2011. So we have regularly provided updates to all of our providers and pertinent partners around these modules and the data analyses that have happened. Our most recent project, thanks to our BOLD funding, is to put the aggregate data that we've been able to collect over the years up onto our Department of Public Health public-facing website. There's still some things happening in the background around that. Obviously, we want all those numbers to be correct and consistent, but getting that publicly available so that anyone in public health, a provider, or even a member of the public could see and utilize that data is really important to us. The other thing that we're really focusing on in terms of priorities center around making sure that the services and supports that are around our caregivers are in place. And we're doing that directly and indirectly. Certainly, we're training our public health providers around what dementia is and the work that's already happening in our state and other states across the country. But we have fantastic partners at the University of Georgia that are actually training pharmacists on using virtual dementia tour and also their program on what is dementia and how that might impact their work. And we're doing that in concert with the regular training of our public health professionals to make sure that folks are on board, understand the importance and the needs of our caregivers that are supporting folks with a diagnosis. That's really proven to be an amazing support for our caregivers. I'll turn it over to Erin and can come back if we have more time.
Erin, you're still on mute.
Sorry about that. Greetings from New York. As I look at the 5 goals from the RAISE strategy, New York, I think is unique in the fact that we have a we're not a BOLD funded state. Our program is not BOLD funded, but we've had a very strong infrastructure in place for many, many years. Actually, since 1988, our programs existed. And we had an increase in funding in 2015, an increase in new funding in 2015. And with that funding, we were able to create this large caregiver support initiative. And under that large umbrella, the CSI umbrella, we have 3 major components. One being our centers of excellence, which are diagnostic centers responsible for diagnostics and early detection, and education and training of primary cares and specialty physicians. Complementing the clinical services, we were able to create a regional caregiver support initiative program, which is our support and service arm of our program. And they provide services and supports to folks living with dementia and their caregivers out in the community. And services such as caregiver education, caregiver assessments, outreach and engagement with underserved communities, respite services, and other caregiver engagement support services. And then the third arm, which really existed even before the new funding, was our Alzheimer's disease community assistance program, which is actually written into public health law. They provide similar services to the regional caregiver support initiative, but those are specifically with the Alzheimer's associations. And they provide community awareness, 24/7 access, and helpline, and training for important constituencies. So faith-based organizations, gatekeepers, emergency services volunteers. All of our contractors are charged with collaboration and communication with each other to form informal or formal partnerships. And when I look at the expand data and research, we did have a formal evaluation of our first contract cycle with one of the local schools of public health. We do use the BRFSS data as well, and to identify gaps and do analysis as well.
Thank you. Great. Thanks for sharing your work. There, as everybody in the audience can see, there's a lot of work already underway. Just these few examples illustrate several areas of work that align with advancing partnerships and strengthening the services and supports, expanding data use, etc. Now, Kina, Erin, and Liz, let's look ahead and think about the future. And could you please share with us what are some strategies or activities that you, looking at the reports from the RAISE strategy, that you would like to be able to work on in the future, and share some challenges or obstacles you anticipate in implementing them?
Sure. So I can start. One of the other resources we do have in our state is Caregiver University. Our academic medical center provides that for caregivers, and it's a multi-session university. But what we learn is that timely information and updated information is always needed. And so we are hoping to increase access to services and information by building an online interactive map for caregivers. So that way they can have access to more timely information within their local community. We feel that'll be essential to both the informal and formal connectivity with providers, healthcare professionals, and just individuals who may not identify as a caregiver, but they're looking for information. So we're hoping to, again, increase that awareness and outreach to have that map so that individuals can have access to that information. So that's definitely one. And I think it'll also help mobilize those partnerships. If we can have those resources available, then we can connect with new community partners who may not understand that they have resources that are really needed for our caregiver community. So.
Yeah, I love that, Kina. It's one of the things, we've had a lot of success here in Georgia with the ALTER program, which is implementing dementia friendly within African-American faith-based community. And the thing that I love about getting that into those communities is that this concept of they can't get enough. They want the next thing. They've chewed through content and they're ready for the next thing. And we're like, okay, what can we do? What can we do? So one of the things we really want to bring and to connect to the needs of caregivers is sort of financial and workplace security, because I don't think much as caregivers often don't self-identify, it's just the thing that they do. Getting folks to understand the relationship between, finances and having workplace security as their own social determinant of health, and do so in a way that makes sense for a community, is really important. We are so far having great luck with incorporating chronic disease self-management type of things in for those caregivers as we're working through our faith-based programs, which is super exciting. But continuing to do that and build it and make things relevant for this population that is so eager for additional content is really important. Their voices guide us. We have caregivers at our GARD, which in Georgia is Georgia Alzheimer's Disease and Related Dementia Collaborative. Our caregivers are on every single one of our work groups. They are the ones that are telling us that they want this content. And so we're allowing that to guide us, because that's where we're going to see the biggest difference made, I think.
Absolutely.
Yeah, and I agree. I think that our outreach to our underserved communities certainly remains a highlight, a priority in our state. Also, too, I would really like to see us be able to include brain health and risk reduction strategies in a bigger way throughout all of our funded partners and our contractors. An obstacle clearly, which probably is a common theme, is funding. Currently, we've funded a very small project for a healthy brain, a very targeted and a very specific county in New York to a very specific population. Using we have a tax checkoff fund. When folks do their taxes, they have a little box that they can check and donate into various different causes and diseases. And we're lucky to be recipient of one of those funds. So we can fund small projects in partial, but certainly not in whole. So I'd like to see for the future, to see if that's something that we can tap into a little bit more. But certainly, working and aligning more with the Healthy Brain Initiative in terms of our strategies in brain health education.
Wendy, Wendy mentioned in her presentation in regards to working with ACL and the John A. Hartford Foundation. And I just want to share, in Mississippi, we are also a recipient of funding from the John A. Hartford Foundation and Trust for America's Health with age-friendly public health systems. So when we talk about parallel connections and not being disconnected, we're actually working across our age-friendly public health domain to work on age and dementia-friendly initiatives. That's another way that we're trying to increase that security of sustainability in our state. And so looking at those built environment areas. And also, I know the area that Liz, you talk about chronic disease self-management. In addition to the CDSMP or the diabetes self-management, we're also looking at ways that we can really reframe Alzheimer's disease as another priority chronic disease. In our state, diabetes, cancer, heart disease, and stroke are frequently what's discussed, but we're intentional in reframing Alzheimer's disease as another prevalent chronic disease condition. And hopefully the funding will be able to match that from a national perspective.
Great. Thank you. Wow. And as continuing this thread of collaborations and sustainability and long-term, could you speak to how can public health collaborate and support the aging services network to increase the implementation and uptake of the national strategy recommendations? Perhaps you can share some examples from the prior work that could serve as teachable examples of ideas for others, for other agencies.
Yeah, I can go first on this one if that's okay. Language between what is said and practiced in our healthy aging network is sometimes different than what it is in public health. And so one of the things that we're working to do as we bring public health on board and we're training them is to introduce them to some of those nomenclature differences. We are really fortunate to have something called the Culture Change Network. It's based in Georgia, but it's actually an international group, and they've taken this on. And they're looking at differences in how we talk about things, how we approach things, and finding some synergies there, which is really important to be able to get us on the same page. Having those culture changes, being able to work together. Communication is one of our biggest challenges in Georgia, not because we're not willing, but we're a 159 county decentralized state. So where we can communicate more and frequently, and even if it's repetitive, we still have folks that'll sit in different meetings, and probably the second or third meeting, if they aren't there, one of their colleagues gets it, and then they start talking about it. So just really thinking of careful, considerate ways to communicate with one another, and to understand that just because I talk about a needs assessment doesn't mean that it's approached in the same way in aging services as it might be here. That's why some of our training is so critical.
Liz, I would echo that response. I know some others probably have heard me say this before in previous webinars, but we often try to be complementary and not competitive. When we initially received our age-friendly public health funding, we used the collective impact framework from Stanford University, and we established a shared common agenda to what you mentioned, Liz, to really bring all individuals to the table and really understand what language was most appropriate for developing our state plan. And I think that's been very effective. We do have our state unit on aging at the table. We have Department of Transportation. We have our Alzheimer's team. So just a number of entities who are having those conversations and really thinking about what is best for the state, not what's best for the agency itself. So I agree with you. I definitely think public health can be more involved in leading that conversation if we start looking at those social determinants of health and using the language that's most applicable to the party that we're trying to reach.
Yeah, and in New York, similar to what you both said, in New York, we do have a coordinating council, which is made up by folks that are appointed by different, legislatures and folks throughout the state. And the Department of Health, which is the program where I sit, where my program sits, and the New York State Office for Aging, they co-chair that coordinating council. And we have all, majority of the state agencies on that as well. So there's conversation on a very regular basis, and then trying to figure out, how to put our conversation to action through work plans and the work that either the funded partners are doing or the state agencies are doing. And most recently, our governor signed an executive order for that charges the health department and the director of the Office of Aging to create a master plan for aging council. And the goal is to, draft guidance for building healthy and livable communities that offer opportunities for older adults. So we just hope that, Alzheimer's team will certainly be at that table for that discussion to kind of help break down some of the silos and be able to serve folks across all ages, all disabilities.
Elma, one question to the group, to the audience, when we get to that point, will be for us as public health, what are some of the perceived barriers to public health involvement that others have that may be not necessarily realistic? I know oftentimes when we reach out to colleagues and we introduce ourselves, it's, oh, well, I just didn't know you were here. It's not that I'm unwilling to work with you. So I'd love to hear from other participants of what some of those perceived barriers in working with public health are, so that maybe we can mitigate those on the front end and better understand how to collaborate.
So this is actually a great segue into our Q&A time here at the end of our webinar with this question from the panelists to you in the audience, especially those of you who are public health agencies. Please submit your answers in the chat, any thoughts, ideas. And at this point, I'm going to hand it over to Joe, our director, to start facilitating the Q&A time. I know we have received some questions from registrants when you were registering a few days ago, and then we will take more from you live here. Thank you.
It sounds great. And so, yes, I hope all of you have enjoyed this great conversation as much as I have learned so much. And again, one of the things we strive to do as part of this particular presentation was to make it as interactive as possible. And again, I want to thank all the panelists. They've actually been answering some of the questions that have been posted in the Q&A box, which has been great. Really appreciate that. And also, if you recall, in registering for the event, many of you submitted questions at that point, and we took the liberty of collating some of those questions and highlighted what we felt were some of the most intriguing ones and wanted to provide those to our panelists now. So amongst those questions, and I'm going to start first with Wendy and John. And I think this is a question I certainly had throughout the National Family Caregiver Support Strategy process is this: will there be funding to support implementation of the strategy for programs to assist first and foremost dementia caregivers, but then caregivers in general? Wendy, John, how would you respond to that question?
I can start, and then John, if you want to piggyback on. So With the release of the national strategy, there was no new additional funding for the national strategy. And so that was one of the reasons why I wanted to also point out, the role of other states and others in providing and coordinating the various different funding sources that they have to use that. So the purpose of the national strategy was to really put out a shared vision and areas of action among all.
Thanks, Wendy. And I'll just add that for two different things. One, from the CDC perspective, certainly, as we've talked about during this webinar and in my presentation, of course, we have BOLD funding. It's not, of course, directly related to RAISE, but as I mentioned, through the roadmap, dementia caregiving is integrated throughout those BOLD program activities and actions. And so I just wanted to mention that, the BOLD program, NOFO, funds states, political subdivisions of states, tribes, and tribal organizations to really implement roadmap actions. I'm sure people on the phone are interested in that, or on the webinar are interested in that. Our BOLD program, NOFO, will certainly be recompeted. We're hoping that an announcement will come out soon. So stay tuned for more information. Once it does, we will share it broadly. So that's a great reason to sign up for our newsletter. And then I also wanted to mention the certain activities, funded activities that come through ACL, the Administration for Community Living, and they also, provide some funding for a variety of different programs that can support caregivers. So, for example, the National Family Caregiver Support Program, which they have, the Alzheimer's Disease Program Initiative. I think in the chat, Wendy mentioned in response to a question around the Lifespan Respite Care Program. So ACL has a lot of great programs and funding opportunities as well in relation to caregiving.
Great, thank you so much, John. Here's the next question, and I'd like to direct this to our three great state panelists here today, and it's this, and this was talked about a little bit, but what is the role of public health in supporting the direct care workforce? And in thinking of direct care workforce, we certainly can think of those in a variety of different roles, whether it is actually in residential long-term care, perhaps as community health workers. Would love to hear your thoughts on that question.
Sure, I can start, and then I guess I'll pivot to Liz or Erin. I think public health has a significant role. I think first identifying those individuals through the data so that people have a greater awareness of those underserved population and vulnerable populations. In Mississippi, we have a very large rural population, and the data and the statistics, priorities, and needs vary greatly from those who have more urban access. And so our direct care workforce has been increased significantly with community health workers and informing those individuals and having them have a better engagement in working with our needs of our dementia individuals. COVID was a great example of Mississippi not recognizing the number of homebound individuals we had. And once COVID hit and we had to identify how to reach those people for vaccines and testing, we realized that we had to have greater partnerships and that direct care workforce had to look very different. And so I think community health workers is one example, but I also think public health provides a wealth of training on essential topics that are necessary to really reaching a larger group of individuals. So those are just some highlighted areas, but I'll certainly pivot to Liz and Erin.
I could say just ditto on what Keena said, because it's absolutely so beautifully stated. One of the things that we're looking at, and I do think is really important when we think specifically of training and being a resource, we're really good at connecting in public health. And so looking at schools of public health, but also schools of nursing, our medical students, those folks need to be brought in and shown what's available and give them the basics so that they have a sense. There are certainly, because again, Georgia is also a very rural state, 4-H, our extension offices, those folks reach students in middle school and high school, and those folks need to know what's available, not just in public health, though we love that Kool-Aid, but also what's available in direct care, because that is such a need for us to be able to support caregivers and support those with diagnoses.
And Liz and Kina said it. I have nothing to add. That's exactly what I was going to say for New York.
The other piece, Joseph, I will say, and Liz made me think of this, for medical students, the virtual dementia tour and just some of those other resources that really give an insight and perspective. Mississippi provides the virtual dementia tour to medical students. And we're also going to now increase that outreach to law enforcement, first responders, and others who will have that community engagement. So I think there are a number of direct care workforce individuals who affect or provide support to individuals living with dementia or Alzheimer's disease that we could really educate to increase that awareness.
Yeah, and in New York, we already, through our Centers of Excellence for Alzheimer's Disease and our ALSCAP, which is the Alzheimer's Disease Community Assistance Program, we do educate healthcare providers, primary care physicians, specialty provider, allied health professionals, folks in long-term care facilities, emergency services. So we, through our funding, we are touching, those populations in that workforce. We can certainly do it in a bigger way, as we, to be creative, but there's more work to be done, but at least we're there.
Wonderful. And Dr. White, a follow-up question from the Q&A from Tori Anderson I wanted to get to, and I thought it was a really good one. So the Caregiver University you mentioned, is that available to people who are not residents of Mississippi?
Because some of the topics of the resources that we provide are more regionally based, it's usually more of a regional. Most of the attendees are from Mississippi, but we have a few from Louisiana or surrounding states, because some of the information we want to be very specific to what they can access. If they need to access anyone for long-term care support or facilities, the contact information we provide is more regional. But we certainly share the link if folks want to see the development. The University of Mississippi Medical Center, the Mind Center, is who leads the Caregiver University. For the BOLD program at the Department of Health, what we do is we refer people to that. I just referred 2 people yesterday who were completely unaware of it, and their family caregivers, and they were needing support. So even if someone is not a part of our state, they could certainly click on the link to Caregiver University. And I believe I shared that with Elma already, that she can share with the group for them to understand the topics of discussion, and then certainly reach out to that team if they have questions. But a lot of the information we share is either state or regionally specific. And so it may not be totally applicable to someone who's not located in Mississippi.
Yeah, Elma, if you could share that in the link, please. And Tori, I'll share, or Miss Tori Anderson, I will share another link in the chat as well, related to like a dementia caregiving education curriculum. But very exciting to hear what you're doing in Mississippi. Thank you so very much. So the next question I have here, and it's also related to at least one question we got in our live Q&A as well, which is, how are we best addressing marginalized groups, particularly groups in which quote unquote the term caregiver does not have a direct translation? So we'd love to hear the thoughts from any or all of our panelists.
I can start, and then everybody can jump on in. So obviously this is critically important, especially for underserved communities, the outreach component. Within the national strategy, and I had to go through it so quickly, but one of the papers within the national strategy deals with very important cross-cutting themes and major principles. And one of those is advancing equity and inclusion of family caregivers. That includes outreach too, because often they don't identify, within underserved communities. And you're right, like in Spanish, for the word caregiver, there's no direct translation, right? So there are a number of different strategies that states have taken. I'll just name a couple that we were really impressed with. So there's outreach campaigns that states have done. In fact, Minnesota, your very own Minnesota, has done a great job, as well as Washington State, Minnesota. We feature those in one of our papers. There's also, there are different vehicles that states can use for this kind of outreach to multicultural communities. That's through their state plans on aging. That's a really good vehicle. Procedural manuals and type of regulations. And then there are a number of different states that have like a task force or a state coalition or a state commission of family caregivers. And that can be used as a really good way to not only outreach to the communities, but as a feedback loop. So I just leave those as a couple of strategies that have been helpful.
Any other thoughts from our panelists here, or would you like me to go to another question? Okay. This is a question that I thought and raised myself from our Q&A. This is from Michelle Murdoch. Michelle, so glad you're on. Michelle and I go way back. And her question is this: do you work with, or are you aware of any work being done in partnership with health insurance companies or managed care organizations, whether it's via foundations, benefits, waivers? I would throw in Medicare Advantage and its kind of potential links with dementia caregiving support. Would love to hear the thoughts of the panelists on this one.
I can start us off again. So yes, that in fact, I think that's a really important partner in this work. Are the insurers, the payers, the plans. They are included in the national strategy for obvious reasons. And there are a couple of different resources that I think are really important. I know the AARP Public Policy Institute, they have some wonderful resources and publications around how, in particular, Medicaid, managed care organizations that are providing long-term services and supports, how they can do it, and promising practices in that area. And then I know that, this has been an extreme area of interest of these kinds of plans that are working with the Managed Long-Term Plan Association.
What do others think?
I mean, the services that we have through our Alzheimer's program in New York are actually free to the caregivers. Certainly those services through our Centers of Excellence for Alzheimer's disease with large medical institutions and teaching hospitals, insurance applies there in terms of their appointments and diagnostics and so much and so forth. But the other services through our programs are free. The only one that, is not necessarily free is, when I say free, but is our respite part of our caregiver support, the caregiver support initiative. If folks are on Medicaid, we encourage, obviously, we're the payer of last resort. So if folks are on Medicaid, they're not eligible necessarily for our respite piece of funding from our grants. But the other services are, there's no means test. It's open to everyone.
Right.
I'll echo with Aaron. In Mississippi, a lot of our resources provided from public health are free as well. All of our chronic disease self-management, diabetes self-management. We're now adding the evidence-based series, Building Better Caregivers, that will be offered free of charge. We also have fall prevention resources, Matter of Balance, and some others, Walk with Ease, arthritis. So we have several that we do provide, not only for individuals who may be living with another comorbidity, but their caregiver, because we often find that caregivers stop taking care of themselves to care for a loved one. As we think about sort of like the clinical component, we do have some community partners who have sliding scale in ways that they really try to provide a reduced rate of services for individuals. But I will say one of the challenges, and I know Elma will get to this, is that some of our vouchers require a reimbursable payment structure. And for some individuals, they may not have the funding up front to even be able to acquire the services to then apply for the voucher. So what we would love to see are vouchers that do not require them to be out of pocket first to be reimbursed, but those vouchers that simply take care of that need, because we do have some individuals who simply do not have the out of pocket availability to cover it upfront and wait for reimbursement.
So, it's interesting, both Aaron, Kina, you mentioned, services offered for free. So when you say offered for free, are these services that are intended to be permanently ensconced in your particular programs, or are they linked to some other grant funding source, say from CDC, BOLD funding? So are they linked to some other source that, you may or may not have long-term access to?
So a little bit of both. It depends on the actual service, but things like chronic disease, self-management, diabetes, self-management, and our fall prevention work is so core to our public health mission. Irregardless of whether or not there is a grant funded source, our agency is committed to providing those resources because we see the benefit and the investment of having that within our community. And also, as we're improving those clinical community linkages with health systems, we're understanding that health systems are limiting their access because they're closing. Many of our rural facilities are closing. And so we have to have a catchment area of ways to really educate, inform, and protect those individuals who may not have a primary care provider who need that care. And so at the core of our public health mission, there are some resources we will always provide, regardless of the grant funding source. And then there are some specifically tied to a grant. And what we're trying to do, as similar to Aaron, is create a network of collaborators that will be at the table to understand if a grant goes away, this is so important that they can step in and fill in the gap. So we're beginning that through our age-friendly public health work and integrating that dementia piece.
Yeah, in New York right now, the services that I spoke about are all state, it's all state funding. Again, the Centers for Excellence, while they receive a very small amount of state funding, they have other ways to sustain that programming through, insurance and being part of maybe a larger institution. But, and working with folks like the Alzheimer's Association, where they already have an infrastructure in place, we just provide some extra funding for some other activities. But majority of us, of our program is, if not all, is state funded.
And I just wanted to chime in as well. These are great examples. Thank you for sharing them. And I just wanted to highlight too that to me, this really speaks to the important role, Joe, you mentioned this in your opening remarks, the important role of public health as a convener, and making sure, that various aspects or various perspectives are included, and that the critical people are at the table or invited to the table to try to find those low-hanging fruit or opportunities for quick or easier solutions, and then also, strategizing for longer term interventions as well. But I just wanted to point that out as, a core role of public health is to convene, and so including payers, insurers, we at the federal level, at the national level, we certainly try to do that. But it's, of course, we work closely with CMS, et cetera, but this is true at the state and local level as well.
Yeah.
And this is one of the things we're exploring in Georgia. We've had a telehealth project where we're focusing in on the diagnostics and getting towards a diagnosis, whereby local public health can pick up an origination fee or the physical site fee, and then the patient is at that physical health department doing a telehealth visit with our Georgia Memory Net sites. And so it's a one-off, but what we're discovering in our conversations is that our public health nurses that have expanded role public health nurses are wanting to write these things into their protocols. They're wanting to write in what are basically, as Keenan mentioned, and Aaron as well, fall prevention and those types of things into what they're already doing. If they have women coming in for women's visits and they're within a certain age range, they're really interested in building that into those services as additional wraparound services. Now, figuring out the funding piece and the insurance piece is its own little beast that we are just now tapping into as an agency. And as a group, but our public health nurses are here, they're ready to do it. So we're going to keep trudging down that road.
Yeah. Maybe, Alma, this is a topic that we can return to for a future webinar. I think that would be very intriguing.
Yeah, I took note. That
Yeah,
was-
thanks, Alma. No, appreciate that. So another question that came up, and maybe I'll direct this to you first, Wendy. Again, an interesting one. So how does RAISE fit in with dementia-friendly communities, dementia friends, memory cafes? Would love to hear your thoughts, and I'm sure that they were at the table in some way, shape, or form in your many deliberations.
Yeah, so I think Kina did a really good job of answering that actually during her Q&A, because she gave a great state example, right, of that and its blend of public health as well as a charitable foundation funding that kind of work. So I really like that. Joe, you're seeing so many synergies, and I know Elma mentioned it in her comments, and you have too, and how do all these different initiatives, whether it's age friendly, but it's also, for example, the Healthy Brain initiatives, which was mentioned earlier from John, and it's the initiatives, of BOLD, and it's the initiatives of, the National Alzheimer's Plan. And I've got to tell you, it was by design that they're integrated, because if they weren't, and we were all siloed and we were all doing our own things, we wouldn't have liftoff. I mean, we wouldn't be able to do it. And so, at the table for the national strategy, for example, we had Dr. Lisa McGuire from CDC, who's a member of the RAISE panel. We heard very much so from the folks who were involved in the national Alzheimer's plan. They came and presented to our council and vice versa. And so there was a real, they were kind of the model. They went first, right? Which was so helpful. So all of these different initiatives, we hope the game plan is that they all are integrated so that we're not in silos. And as Aaron and Kina and Liz have said, what's so important is then you have all of the different, even within a state, all of the different agencies, not just public health, but you have aging, you have, all the agencies which touch family caregivers, which are a lot, then you have them all aligned as well. And it's easier for everybody to work together.
Wonderful. Thank you so much. Appreciate that. I think this was discussed a little bit, but I'm going to bring it up again because it is a critical issue here. And so Michelle Savage writes, I'm a caregiver support specialist at Locust Street Resource Center in Carlinville, Illinois. We're a rural area resource center, and I've been having a very difficult time finding resources that encompasses all 10 counties that I provide services to. Anytime I look for a resource, it's only for counties like Springfield, Cook County, where Chicago is, Madison County, St. Clair counties. Is there any way to get help in the type of area I live? And so, John, yeah, if you'd like to address this, that'd be great. And then others too, of course.
I'm sorry, I clicked that button.
It's okay.
I keep clicking that button, but I don't know what it does. I'm sorry. I'm happy to take a first stab at it, though. I mean, thank you for reaching out. We are happy to also provide support and direct you to resources. There are great places to go to look for, support of, like, there's the best practice caregiving resource from the Benjamin Rose Institute, and other various resources or repositories of resources. I would also point you to, the BOLD Center and their collection of resources as well. And certainly, we are at CDC are also, for example, very interested and focused on rural communities and trying to, elevate the, we're critically aware of the lack of resources, and so are intentionally trying to elevate the role of rural communities in some of our efforts. So without saying too much, I'll leave it there, but I just wanted to offer my support as well and thank you for raising that issue.
To echo John, just a couple of thoughts. You may have a state rural health office. So in public health, our state rural health primary care office is attached to the Department of Health. So your state rural health office will be one resource because you are looking for probably underserved communities. If you have area agencies on aging, I would reach out to them to see if they have the coverage area for the counties of interest. In Mississippi, we are very fortunate to have a Mississippi Access to Care network. It was developed and encompasses every AAA in our state, and you can call one number and they'll direct you to the area agency network in your area. So I would definitely, from a local state level perspective, reach out to your state rural health office, but also if you have area agencies on aging, or if you have the councils on aging that are locally in your state, reach out to them. And if they do not have the coverage of your counties, they can probably refer you to someone to give you that local coverage. Another opportunity, and we do this in Mississippi as well, is work with our state AARP chapter. They also have a wealth of resources, and they could probably have individuals that are representing those counties and connect you to other individuals that can provide you that support. So sometimes it's a snowball approach, reaching one person and then getting the avalanche and they connect you to another, but just mobilizing those conversations is another way locally that we've been able to connect people in those rural counties who may not have the advantage of some of the resources that are more populated in those metro areas.
Yeah, everything that Keena said, one of the things that we've worked hard on here in Georgia is to reach out to the resource that are our extension offices, which are going to be primary in rural areas, and actually going in there and finding out what they want and how they want it. Looks a little different than it does in your normal urban or suburban areas. So they've been a really great resource in figuring out what type of resource would be best so that you can better focus in your resource search. Our healthcare coalitions that we have in rural parts of Georgia have also been really helpful for not only connecting care, but who else should you be reaching out to get things going in those rural areas.
Yeah. So Liz, you mentioned extension office. So I assume you're referring to extension office of the University of Illinois extension. Or when you say extension, yeah, the university extension. Yeah.
Yes.
Okay.
Yeah. Yeah, so through University of Illinois, they should have, I want to say it, in Georgia, it's one in every county. So there should be a one in every county there as well. Yeah.
So, yeah, I mean, for those who aren't familiar with an extension office, every state in the US has what's called a land grant institution. I believe in Mississippi, it's Mississippi State. It's by the land grant. Yep. In Minnesota, it is University of Minnesota. Michigan, it's Michigan State. I mean, so, you know, sometimes it's not always obvious which one it is, but as part of the land grant mission, I believe all land grant institutions have these extension offices that sit in every county of the state. It's kind of similar, I would argue, to the health insurance plans in some respects, depending on the state. It's an untapped resource.
Yes.
These are offices that have often very good engagement with local communities, but often in the space of agricultural education, 4-H, those kinds of things. But some states, North Dakota is one, I'm sure there are others, and perhaps Georgia is too, Liz, that have also pivoted to moving in kind of the aging education space. And, you know, for those of us that are kind of looking at this and who can we engage with and who can we tap, I would argue extension offices are an untapped resource in this space of caregiving support. I really do. You know, the other thing too, related to rural counties is, you know, one thing I've been doing is I've been visiting every county in Minnesota to provide dementia education, to hold conversations around dementia. I mean, it's going to take me a long time. There are 87 counties in Minnesota, so I got a ways to go. But of course, as you can imagine, most of these counties are rural, very, very different from the Minneapolis-St. Paul metro area. And one thing that has always surprised me when I go to these counties, and we engage with the local AAA, we'll engage with the regional coordinator of the Alzheimer's Association, we'll try to call the extension office, although in Minnesota, the extension offices haven't really pivoted as much to aging. And the reason I do that is I like to have local resources there for families and others to let them know what's available. And I am always surprised when I go to these counties, there are resources out there you just wouldn't expect that are in this space of providing caregiving support and services. Organic, whether it's church related to churches or other organizations that you wouldn't necessarily expect would be working in this space. And, I guess in the end, what I'm trying to get at is and I think this is all of our responsibility, is to really approach all of this with, from a humble standpoint and an engaged standpoint. Because sometimes communities have resources and resilience that we might be surprised about, and it's probably important for us to know about them and to partner with them. So.
And I also think, Joe, including them in policy development.
Yes.
What we have heard is not developing policy and then entering the community, but meeting the community, and to Liz's point, asking them what they need, and then being able to formulate a plan, because that increases the engagement, but it also increases the adoption of the practice or the effort. So we've definitely learned that practice as well.
Wonderful. And actually, a really quick, Bailey Huffman, thank you, Bailey, for providing this. I believe the person who asked the question about the rural, the family caregiving support in rural Illinois was Miss Savage. And Bailey Huffman has said she'd like to connect with you about engaging in rural Illinois. Again, public health in action, right, John? So we'll try to connect you, Bailey, with Miss Savage here. I have your email and we'll do that. We are kind of at time here. I don't know if our panelists have any final thoughts or comments they'd like to share with everybody.
Well, I would just say thank you. This has been more of an educational opportunity for me, just listening to what the other experts are doing, Erin and Liz, and just really knowing that there are no limits. We really have a great opportunity to touch our caregivers and highlight their needs and priorities. So this is really exciting. Thank you all again for the opportunity.
Yeah, just echoing what Keena said, I'm really grateful to have been able to participate and hear what everyone is doing. Actually, someone in the questions mentioned APS, and I've realized they're not at my table, and I need them there. So we'll be doing that. But to have this sort of this ability to have these conversations is really critical to keep moving the work forward. If there's somebody not at your table, get them there. That's how you're going to get the work to start.
Yeah.
I'll echo the exact same thing. I learned a lot today, and I am so excited about what you all are planning on doing. So, Keena, when you have your online map of services for family caregivers, please let me know, and I'm going to share it with all the other states, because I think that's going to be key with this, is sharing what we're doing and copying each other. And, the states always need to tweak it for their own state. But if you got a great idea, let's get that out there. Same in Georgia. Liz, if you can share kind of the dementia friendly with your African American community, that is super exciting. I would love to get that out there. And then, Erin, I've got your number, but the work that you guys are doing around outreach is just phenomenal. And again, if we can get that out to again, in this, in a huge effort to share, what's working and all these exciting things you're working on as you develop them, please let me know. And then we can turn around and share it with our network as well. So again, thank you so much for the opportunity to even be on this panel. Really appreciate it.
Yeah, I would echo that too, just briefly. Thank you so much. It's always so energizing and exciting to hear about all the amazing work that's happening at the state and local level. That, to me, that's really where the rubber hits the road and where that critical impact happens. So thank you for sharing, so that people can, borrow shamelessly, as Wendy said. And I hope it's also just been for me, it's been really helpful to see, and hopefully for all of the participants to see how, all of these initiatives are really working in concert with each other, and really from a, zooming out to a national perspective, it's all working towards really achieving a shared vision. So, which is wonderful. But that activity and that action has to happen, at that ground level. So thank you.
Well, with that, I think we will close our very, very exciting, robust discussion and webinar today. Just wanted to remind you, and I think this is really dovetailing with some of the comments, particularly John's, in terms of learning from each other. We have begun to convene a bi-monthly series of events that really highlights states that we believe are doing exciting, innovative work in the space of public health and dementia caregiving. Dr. White in Mississippi was our inaugural presenter for our virtual roundtable series. And later this month, Tuesday, January 31st, we will be highlighting California, and we'll be doing this every other month. So please do join us for those presentations. And we have a whole series of other topics we're going to be addressing as part of this webinar dissemination strategy. And I just will leave you with, please do visit us at bolddementiacaregiving.org. You can see the recordings and view the slides of many of our prior webinars and other dissemination efforts. We are on Twitter. Please follow us there. And also, if you do have time, please do try to take a moment to complete our evaluation. That's very, very helpful for us as we continue to refine our topics and our approach to getting the best information out to our communities. So thanks again for joining us. Thank you to our panelists. Wonderful conversation today, and we'll be seeing you soon. Thank you so much.
Thank you.
Thank you. Bye.
Thank you, everybody.